So I haven't made a video in a really long time. It's November 24th, 2018, and I am in my 21st month of tapering off of Mirtazipine, also known as Remeron. I've been connecting with some people, other women, who are also coming off this drug, and that's one of the main reasons I made these videos, was so that other people who were going through the same thing would know that they weren't crazy and would have someone to talk to. So I'm super grateful that people have reached out to me personally to talk about their own journeys with this horrible poisonous drug. And I'm just here to report my new symptoms and where I'm at. I just did a 7% decrease 2 nights ago. So that's more than I have been doing. The decrease I did before that, which was 3 weeks ago, was 5%. And that was my first 5% decrease. Prior to that, and this whole time, I've been doing like 2 to 3% decreases about every week or so. And as I'd been creeping closer to 3% and then closer to 4%, I've been holding for longer, like 10 days instead of a week. And then when I did the 5% decrease, I decided to hold for 2 or 3 weeks just to see how I felt. And it seems like I probably could have done another decrease after 2 weeks because I didn't have a lot of symptoms after that. But it coincided with my PMS cycle, and I knew it would be bad to have my withdrawal symptoms kicking in right when I was also having sort of emotional turmoil. So I held for another week and just did another decrease, like I said, 2 nights ago. And I decided to do more than 5% to see if it would, you know, feel the same, if it would feel different, if it would be more intense, if it wouldn't work. And so far, I've noticed that I have similar symptoms to when I did that 5% decrease. So hot flashes and sweating, irritability, diarrhea. I have a migraine now, and pretty sure it's from withdrawal because the withdrawal has been increasing my chronic migraines. And I actually got more migraine medicine from my doctor, which I'm really happy about because I'm getting more migraines towards the end of this withdrawal than I have been getting, and I need more medicine because I have to be able to function. And my migraine medicine is one of the pharmaceuticals that I do tolerate and that has saved my life from chronic pain. So I'm grateful for it. I don't have side effects from it other than it makes me tired. It's called Maxalt, and I've been taking it for over 10 years, and it works really well if you take it like right when you get a migraine, when you think you're getting one, instead of waiting. Anyway, so on to my new symptoms. Some of the things that I've been experiencing have been pretty intense, but short-lived. So the last 2 decreases that I did, not including the one that I did 2 nights ago, but the 5% decrease that I did 3 weeks ago, and then the 3.8% decrease that I did before that, about a week afterward, I had what felt like an intense stomach flu at like 5 a.m. Severe cramping, severe nausea, totally thought I was going to throw up, but I didn't. And then diarrhea, and then a migraine. And that lasted for about 2 hours. I mean, the migraine was all day, but like the intense stomach stuff was for like 2 hours, from 5 a.m. to 7 a.m. And then it went away. And I actually thought I was sick until I saw that it happened again after a decrease. So I'm expecting that to happen again, maybe a week from now, maybe sooner, since it was a bigger decrease. I don't know. I'm also having some days where I feel almost like euphoric, almost high. Like I feel so good that I can't even believe how good I feel. And I don't know if that's like part of withdrawal or I'm just having a really good day. But it's nice to feel that. I'm still having nausea throughout the day. And I mean, it's coming and going. I'm still having vivid dreams. I'm still having tooth pain. I'm looking at my journal here. Where like all my teeth hurt. Usually it's the top ones. It's not like, oh, I have a toothache. I don't have any cavities. I just have my teeth hurt. It's like a nervous system thing. I'm having a little bit of ear stuff. A lot of people in withdrawal complain of tinnitus, and I'm not having a lot of it, but I'm some of it. And I'm also noticing things that other people have mentioned experiencing that I never really attributed to withdrawal until now. I joined the Facebook group that's called Remeron should be illegal. And I've been just like watching other people, what they're posting and their symptoms, and I'm noticing that there are some things that I never thought were part of withdrawal, like difficulty swallowing, difficulty gasping for air. I thought that I just had sleep apnea because I got fat from the drug, and I was like, couldn't catch a breath in my sleep if I was on my back. But it turns out that I was actually experiencing that breathlessness and inability to take a breath or take a deep breath or deep enough breath early on when I was on this drug at 15 milligrams, when I was nursing a baby and having to drink a ton of water all the time. And I felt like I couldn't get a breath soon enough while I was drinking, and it actually caused anxiety. It was really a bizarre feeling, and I didn't realize that it was part of the drug, but now I do. Also, difficulty swallowing. I had that tonight. We celebrated Thanksgiving with my family, and I was having trouble with my dinner. I mean, it's not to the point where I'm like choking, but it's like noticeable. Like, okay, why can't I swallow this like normal? Like it just takes a little bit longer to go down. It's a little bit more uncomfortable. Let's see. I'm still having super, super exhausted days where I feel like I could just go to sleep at any moment. But of course I can't nap because Remeron, withdrawal. It's a drug that makes you tired and makes you sleep at night when you take it, but during the day you're tired as fuck and you can't sleep at all because it's screwed up your body and your brain and your sleep. Let's see what else. Migraines, dizziness. I'm still getting those weird spots like in my wrists that really hurt. I mean, it's not like so bad that I'm crying out in pain, but I notice it like, ow, my wrist really hurts, just like in one little spot for like 3 minutes, and then it stops. And then also another thing I've been getting is tension in my shoulders that I didn't used to have. I mean, I haven't had it since I discontinued drinking caffeine, which was years and years ago. So I don't know what that's about, but that's coming up. I'm getting weird rashes. I had a rash on my ring finger, like right here, right above my ring, that came and went over a week. I did nothing to it. And then I also on my toe had like a big ouchy red bump on the inside of my big toe that was like inflamed and painful for like a day, and then it went away. Interestingly enough, that part of the big toe is the end of the liver meridian in acupuncture. And I also noticed that the inner part of my lower leg is very tender. So I've been doing foam rolling on that part of my leg, which is part of my exercise routine, to sort of like clear the liver channel. I'm just wondering if that little red bump was like a detox, my body just getting rid of this shit, this drug. So that was interesting. I'm still having a little bit of brain zaps. They actually feel more like a boom to me, and they happen when I'm trying to go to sleep. I usually only have one, but I'll close my eyes, I'll start to get ready to go to sleep, and then it'll be like boom, and it almost feels like being hit in the head, but without actually being hit in the head. It's like an internal, I don't know, and there's like auditory, there's like a sound like boom. It's weird, but that's how it is for me. Anyway, this video is getting super long, so I'm going to stop. But I just wanted to check in, and I will keep you posted as I go. Again, I'm at 2.2 milligrams, which is awesome. And I am pushing to be done with this drug in the next 6 or 7 months, as best I can. So I know I have to go slow, and I know I have to listen to my body, but I also want to be fucking done because I'm so sick of this shit. And so I'm going to do what I have to do. Good luck, everyone.